So what do we have with chapter one? What is anatomy of violence? I mean, what is that about anyway? People get hurt in healthcare. How is that? Well, these are all the different things that I hear from the general public. Nobody understands why and who would even find the desire to hurt a healthcare worker. Well, we're going to get to the bottom of that, and some of these statistics are going to be extremely shocking, and it but it's also going to be something, if you've been on the front line for a while, you would understand that this is a common occurrence. It doesn't happen just in one area. It happens a lot in certain areas, but it's not limited to one area. So the one thing I would like to mention is that when you have somebody going through a mental health crisis or even addiction withdrawal, that they could be on any floor at any given time in the hospital or healthcare setting. So objectives of this lesson is to name the methods of abuse and violence, discuss variations of abuse, synthesize learned information to develop an inclusive program of everything that encompasses everything, and justify the value of knowledge and support with a positive work culture. Without the positive work culture, will you have a positive work experience? No, you probably will not, because you can't have one-sided stuff, right? You got to have the whole thing. Like, you have to have not just one or two people getting along. The whole floor as a functionality will make the unit work and flow much better. So when we have situations where we have a fast food society where people are like, go, 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 and we're always super busy, but what about building relationships? Have we not seen that disappear in so many, in recent months and years, where it's not about stopping and talking to somebody? It's about, it's turned into more of like, what can you do for me? Well, we've seen that a lot in healthcare, that's for sure. Because with the patient care surveys, which we're going to get more into, really has biased everything to make it look like either the doctor or the nurse is not meeting their needs. The future of HCAHPS is going to be exactly what I'm teaching. And what is exciting about this is that we are the innovators with Nurses Against Violence Unite, and we are going to change literally the face of healthcare. So by working not only on ourselves, by filling the gaps of knowledge that we need to know, even all the way from back in nursing school and even medical programs, to take it a step further and apply it to not only what we know, but how we practice. So to eliminate as a common consensus, for a whole consensus of the healthcare system. So this is pretty interesting, because when we talk about the circle of violence, okay, it is very important to understand that, and we all know this, but yet sometimes we don't want to acknowledge it, that we really know this as far as for us. Where the abuser, you have, the different areas we're going to talk about, you have the abuser usually turns into the one that was abused, right? Or, vice versa. So how does it all begin? We have bullying, how does that all translate into what we are suffering from on the floor? What about neglect? And then the lack of education, which should be probably the first one, but I picked bullying because bullying has been going on since we were kids. And then we have workplace violence, where if you have all of these things that are going in line, and then you get all the way to workplace violence, and then so what was happening at home and during when you were a child starts to make a big circle, right? Going all the way to you becoming, well, of course, you're the victim. You're the one that is choosing to be the victim, because we're going to help you understand the things that we can do as healthcare workers to get ourselves out of that break that cycle, right? We have to break that cycle, because we are putting ourselves in this little tiny box, right? Our little box, it looks a little bit like this. I'm sure you guys have seen some of my webinars where I'm like, I love my little box, but yet you have to get out of your little box. So it's very important to be able to go from the outside looking in to see exactly what could we do better as individuals and as practitioners, because what we do, it's a rippling effect among many patients, as well as also not only our family, but yeah, the patients and our relationships at work. Bullying, so defined. This is the definition: aggressive behavior that involves minimal to several forms of harassment. It could be like personal attacks online and in person. It could be making fun of a way that somebody's scrubs are fitting. It could be the person, passed gas in their room and that you think it's funny, and that you are continuing that joke, but it's not really a joke. A physical violence to taunt the victim, right? So, what is happening? Are they hiding things? Are they turning off the nurse's pump? Are they, what exactly is happening, right? For bullying. So when we were kids, it used to be teasing. It used to be, laughing, calling names. It was a lot more of that. But as things have evolved, it's gotten to be more, uh, um, evil, I would say would be the right word. And it also creates a very hostile work and school environment for not only the child when they're trapped in this little tiny box, thinking that they're not worthy, or they're not beautiful. Sorry, I do have something in there, that they're not beautiful, that they are not smart, that they are not able to accomplish the things that they've always wanted to do and they dreamed about since they were a little kid. So it's important for not only ourselves as patients, but also, as patients, as far as like, if we ever should be a patient, but also as being the nurse, as being the mother, the father. It is very important that we take our child and we look at this child as being abused by their peers and even the abused wife. These are all the same behaviors that we've been seeing on the floor, right? These are all the same behaviors that has been circulating for many years, and it just has gotten even worse, to the point that it's actually literally ruined careers. It has, nurses and frontline healthcare workers have worked on, they've committed suicide. There's all different kinds of negative factors that have happened because of bullying, right? So when we look at bullying, it is a huge factor into what has happened as we've gotten older. So, but how does it start? So I took this from a yearbook from when I was a kid, and I bet you can't. I bet you can't even realize who am I in this picture. When you realize it, you'll probably laugh. You'll probably be like, "Oh my God, she looks terrible," but this is me, right? So I'll be happy to show you. So this little silly thing over here with the glasses, with the big old smile, that's me. And I was made fun of. I was tormented. I was called a little boy. My mom cut my hair. I did look like a little boy. And I always felt like I wasn't beautiful like the rest of my friends, that, I just really, I felt fat, ugly. I mean, it was just, that's the way that kids also made me feel. And I started believing that. So, but that's what happens with children, adolescents, and teens. And then they grow into adults. There's teasing, subtle backhanded comments, things that you don't even realize that are being said, and they're being said. You're like, what happened? Where did that come from? And then you have name calling, drawings of like, you of being like a whale or something like that, throwing things and injuring the victim. Like you've seen kids that, throw like wads of paper, but now they put stuff in it, like paper clips and stuff like that. And then they label you as a loser. Does this change when you get older? No, it just is done in a different kind of way. We have sibling rivalry, one versus the other, and ongoing battles. So, and then we have labeling, adopting beliefs, stereotyping individuals from their, in their environment, from their environment. and low self-esteem. So with all of this little tiny mind growing up, you start to believe that all of the things that were said about you as a child were really not really true, that it was the person inside that was saying that about you was the one that was really hurting. So when you were friendly and you were, being fun with people and laughing, you were the easy target. So when you have a low self-esteem, feelings of inadequacy, then you have unworthiness, and like you don't feel like being happy is even in your deck of cards. And after a while, that starts to build on that little mind, right? So when that little mind is not going out for recess, when that little mind is not acknowledged that they might not be the same as other kids, like when we talk about mental health, most nurses have never been taught about autism. Most nurses have never been taught about acute mental illness. And that's where we are filling all that gap in, right? And roughly after I got done with my doctoral program, I found out that I have Asperger's. And this has been something I've had for so many years. Now, this is a little personal, but we have this child that you see right here. I didn't feel as beautiful like my friend that was next to me, right? But I was in my own way. I was silly, goofy, but I learned differently as well, didn't I? So, did I feel like I was smart when I had people that were making fun of me and calling me a loser? No, I did not. Most kids did not. So, if this is triggering to anybody that is listening, I apologize. But these are the things that people don't talk about and how they compile to make a sour workforce. Okay. Now we are working with hurting people, right? We are hurting, and we have people that are hurting in society. So how could we effectively take care of people if we're hurting ourselves and we're not identifying these issues before we become nurses, or even while we're becoming nurses? So when we talk about bullying and how is it involved in education? Well, in K through 12, and then you have undergrad and you have graduate programs. There is recognition of maladaptive behaviors. There is a lack of tools and resources. This is an ongoing thing in education. We hear this all the time, that teachers don't have enough supplies, educators don't have enough supplies to teach their nursing students. Or what about in med school? I'm sure that they might have a little bit more supplies. But when we are teaching nursing students, we have to use things that are 20 years old practically, or the things that will be used in a third world country. I'm not complaining, but this is the reality of what is out there. So we are teaching nursing students with historical was it um um prehistoric supplies, I think is what I want to say. So we're teaching nursing students with ancient artifacts. And even though that they have the same idea of what we're trying to do, it is not completely 100% of what we need to show them, because it's not up to societal trends, right? New innovation, this can do better than the old product. We aren't showing them the new products because they're hard to get a hold of, because schools don't have the funding, right? And that's the other tool. So, and a lot of times when you have somebody that's misbehaving in class, they get that negative reinforcement versus the person that's quiet. And when that person's going, ooh, 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 right? Trying to get the attention. I'm sure some of you 80s kids out there, you'll remember when there would be kids that would be standing up and, and they would get that attention. We would be kind of like, I'm not going to say a thing, right? Because why would you want to start anything? And why would you even say anything? Because you're not going to get picked anyway. It's kind of like the same things that are happening in healthcare, right? Why report? Because it's still going to happen. And why report? Because nobody's going to do anything about it if I say something to them. see, there's a little bit of, there's a lot of the same patterns going over and over and over again. So I also mentioned about a lack of education of autism, traumatic brain injury, and even ADHD. So when we talk about education, we talked about it in the last couple slides, where you have these children that are being taught that their homework and their priorities at school are more important than them getting exercise and enjoying being friends and, with their friends on the park, playing and goofing off, laughing, screaming, shouting, having fun. That has been taken away. Their recess time is shrunk as they've gone through their program, and to the point that they're forced to pretty much grow up, and you got to do this and this, and there's your tasks, right? So we always talk about task oriented stuff. Well, that's exactly what's happening with these children. They're being taught in the K through 12, and then it compounds itself as as time goes on. So when you have somebody that has autism or TBI, even high functioning, the learning modules, the learning styles are not adhered to in every situation. So when people have somebody that has ADHD when they're in grade school, that doesn't go away when they get older. ADHD, the hyperactivity, as well as also it turns into the more inattentive type as they get older. What happens is that person, number one, doesn't have their coping mechanisms in hand, for the most part, because their recess has been taken away, but they're being molded into this like nervous being because they're not able to get their energy out, right? So, and then they're given meds to mask it, right? I'm not against medications. We all need a medication here and there, and it's nothing to be ashamed of, okay? I'm on medication for ADHD because as you have that person that has a TBI, a traumatic brain injury, it will turn into, right? They might have ADHD, especially with high functioning autism, right? Or Asperger's. So when they have the inattentive type, when they get older, their attention span gets less. So they need to have medication in order to be able to focus on the task at hand, right? So, but the learning modalities have shifted. So when you're not in K through 12, you're now in undergrad, you're going to nursing school, and then you're going through graduate school. Graduate school is a lot easier for me because I was able to do it at my own pace, still with timelines, right? But when you're in nursing school or even med school or even, going to college for whatever degree that you're going to, and what ends up happening is that you're not considered unless you have an IEP or a 504. They're not going to say, nobody's going to say a word to you unless you say something to them, and then they'll refer you to the disability office. That's automatically a disability. No, it's not a disability. When somebody has a mental challenge or a mental, I call mine a superpower, you're labeling me, right? You are labeling me as somebody with a disability that is not 100% functional. Now, what do we have with stigma? Right? That has a lot to do with this, right? So you're putting me into a category and you're labeling me as somebody that is unable to function at a normal level. Yes, I can function at a normal level. I just need a little bit of accommodation. Maybe you need to repeat something. Maybe you need to show me on black and white and have me do it, because that is how people learn, right? And then, so we were talking about accommodations, and they're not followed for the students, not even the worker, right? When you're going through orientation, yes, you're expected to know your job, but if you have questions, you should not be penalized for asking questions if that was your learning style. And we don't think when we go to fill out an application, if we have a little ADD and ADHD or whatever you want to call it, most nurses do, right? We're not going to sit there and admit to it, right? Because that was a childhood disorder, right? Am I making sense? So The lack of mental health training is very important here, because if we don't have that, and most nursing schools only have bullet points, you're not going to have a better understanding of yourself. You're not going to have a better understanding of your peers or even your patients. So are we doing our patient population a service? No. So, and we also have student hazing. We also have new employee hazing. We also have, whereas, you do, there's like, jokes and stuff like that, just to make somebody feel, oh, I'm not that smart. Like you get a doctoral level nurse that's working on a med surg floor, you automatically shoot them down because that's what you do on the unit, because you want to see what they're made of. I mean, come on. Everybody's going to earn a paycheck, and maybe that nurse wanted to take a break in order to be able to feel back at home with themselves and to keep up with their expertise. So you can't haze people in a positive manner, because what it's going to end up doing is it's going to cause a friction on the floor. And in return, if you're bullying them, what's going to happen? Right? So I'll leave you with that, something to think about. So the educator is also not practicing mental and physical wellness, right? We get caught up in grading papers, and this is all the way from K through 12, right? We get caught up with grading papers and we can't keep up. We're going to school, we're trying to do better for ourselves, as well as we also have kids. We have all these different things that are happening in our lives that we tend to neglect ourselves, and therefore somehow we get angry and we lash out at people to a degree, right? So there's no outlet for this educator or this nurse or this doctor that's going to school and working on his residency or her residency to decrease their mental, there's no outlet to release, right? Because they need to have some form of release in order to be effective with taking care of patients and effective in their own personal life. So it's very important that we are connected with understanding these concepts, because they're pretty easy, but yet we don't really think about this stuff and how it all ties together. So how does bullying happen at work? Well, the work environment, you have lack of relationships, you have no time. You're not supportive, or you are supportive, but you're only supportive with a few people because your workload is so high, you don't have any time to really get to know anybody else that you're working with. The acknowledgement, there's no acknowledgement. Hey, you're doing a really good job. Not that you really need it, but it's good to be like, hey, do you need some extra help? I have an extra hand, right? Not like this kind of hand, but like I have another hand that, if you need something, I'm here for you, because I know that you'll be here for me. That's a part of building relationships, especially on the units. Specialized knowledge, right? So we have a healthcare system that has labeled everybody, right? We have ICU, which is the super critical people that we have, I feel the more organized people that in the hospital. We have the ICU folks, then we have the ED folks, which are so much fun. That they kind of go hand in hand with the ED, with the mental health folks, because the mental health folks are kind of just like, oh, watching them, and the ER person's like, right? But yet it's an organized chaos, and I love organized chaoses, right? So, but you have these sections in healthcare. Oh, I'm not a geri nurse. You're not a real, what? Have you ever heard of that? You're not a real nurse because you work in geriatrics. Are you serious? That doesn't work that way, right? So specialized knowledge would be the gaps of care, right? So we have worked always in medicine, right? We've worked to memorize those meds. You can't, you have your 6 rights, you have this, and this, you have to remember this medication. And if you don't know, look it up, which is always, there's a key. You always got to look things up, right? But if you don't know, you look it up, and it's always about the medications. Did you know that most problems can be resolved by acknowledging somebody and sitting and talking to them just for a couple minutes. We all know this. It's a no-brainer. If you build relationships, you have less liability, you have less issues on the floor, and you have a fantastic shift along with your patient. You can get them laugh, you got them in your hand, right? So it's very important that we prevent problems before they get worse. And I'm not saying be a waitress. I'm not saying go out of your way, which we do on a normal basis, but over accommodating comes off as being fake. And especially with somebody going through some form of distress, that's not going to go over too well, right? And we're going to get into that as well. And then we talk about time. We don't have time because the computer is not working correctly. We don't have time because the EMR system is terrible. We don't have time to learn the task, perform the task, decompress after a traumatic event or like something that happened on the shift, right? You just lost your 5th patient from COVID. Do you have any time off? Probably not, because you have to work because you're either a single parent or you have some sort of circumstance where you have to have an income coming in and you have no PTO time saved, or whichever the circumstances. You have to work, right? And you have to keep up with the demands, all these task-oriented things, in order to be able to, be that effective nurse, to be that person that you're supposed to be on the floor, right? And you should want to do 100%. That is what we always strive to do, but it comes with a price. And we get back to the reasonable accommodations, right? So it's reasonable accommodations. You help each other out, right? And adhering to learning patterns and how people work. Not everybody's going to work the same. And then we have resources to help with tasks. Do you have enough, medications? You should have your medications with Joint Commission, but do you have enough supplies that you need? Do you have literature handouts? Do you have somebody that can take over for you for lunch? Do you have, did you run out of bandages that you need on the 3rd floor, but yet nobody can, break free because everybody's so busy? I mean, do you have all of these things to help you with your daily functions on the floor? And then adequate sleep. So you're juggling work, you're juggling kids, you're juggling, schoolwork on top of their schoolwork, because now we're doing homeschooling. So are you getting enough sleep? Did you know that after the 3rd day of inadequate sleep or no sleep at all, you start to have some form of delirium, where you start to have a little bit of, you start seeing things, you can, hear things, and, you have delusions and hallucinations. Like, you have to have sleep in order for your body to repair from all of these high stress episodes that you're suffering from, right? So when you're being bullied on, when people are, you're worried about your job and you're at the heightened sense of alertness and it's like ongoing, right? It's a bad thing. And then when you're go, and you have no time, are you going to eat correctly? Probably not. You have no time, and the time that you want to spend, cooking, you're taking away from your kids because they're off doing something else. So going to a restaurant or, getting food taken in, right, from a restaurant is easier because you could just sit and hang out with your family. And you don't have to worry about cooking because nobody in the house can cook because they're kids, right? So your diet's not going to be correct. So what do? Right? So I want to make sure that you understand, I am pointing out all the things that are wrong in order to be able to fix the problem. Okay. So the first step is awareness. That is the biggest thing with Nurses Against Violence Unite. In order to fix the problem, we have to open up and we have to talk about how bad it is, right? We have to talk about, and we do that a lot in Nurses Against Violence. We have got to talk about the issues. We've got to talk about like deficiencies in care. We got to talk about, how we feel about what's happening. And then, even about what's happening with, maybe your boss said something that wasn't nice to you. Well, wouldn't it be nice to have that support, to have somebody else come in and say, hey, you know what? That's happening to me too. What can we do to be better? What can we do and learn from this? What can we do to protect ourselves. Okay. Because a lot of times we are not taking care of ourselves, both financially, both and also emotionally and physically. So how are we expecting people to take care of us if we can't take care of ourselves? How are we going to take care of other people if we aren't willing to acknowledge the things that we don't understand and that we don't have in order to care for them? Okay. So why does bullying happen? We have a lack of control, lack of power, underlying hereditary issues, unresolved trauma like childhood experiences, life events, experiences. Then we have beliefs. What does this person believe? Like we hear a lot about, oh, I'm not going to take this vaccine because, or, this person, they're rude because, they're just mean, and cultural differences. Well, in our culture, things are different in our culture than they are in, like, we'll say China or in Italy, or, they take naps in Italy, right? For breaks, they take naps. Call me out. Tell me that's not true, because I'm going to tell you, I have relatives over there and that's what they say. They take naps. Not reporting the incidences. So what does that do? You're getting bullied and then you're not saying anything. So then we're going to talk about neglect. So what is neglect? You got physical, basic needs, food, clothing, shelter, safety, and security. Then you have emotional, which is the lack of support or stimulation and growth. And then you have people are ignoring you, they're intimidating you, which also comes in line with a little bit of that bullying thing. And they're doing it also through isolation, right? What do we have a lot right now of? We have a lot of isolation. We have single parent homes, right? I grew up in one. A lot of us grew up in one. A lot of us are, raising our children by ourselves. The lack of support from the other parent, it's neglect, right? Not adhering to or avoiding reasonable accommodations in work and your education. If you're having trouble, you should be able to say something without feeling like you can't. And that should be something that is paramount in that work culture. If that's not paramount in that work culture, then something has to be done, and something needs to be, like, we're recognizing that problem. So let's find a way to fix it. So that's what we're going to do later in the program. Then we have medical inadequate health, or dental care. So if you have adults that come and they have been smoking meth and they have holes and stuff like that in their teeth, we have children that would come in that were drinking bottles when they were babies and they never got their teeth cleaned. So they have rotted out teeth. They're unable, we have these people, they, for like adults, they unable to get medication for infection or mental illness. Fear of divulging a mental illness due to retaliation, and a loss of employment. So it can happen as a result of, or it can happen as something that kind of goes hand in hand. And then we want to talk about, we were talking about the broken teeth, soiled clothes, sores, that are infected. We have people sometimes that would come in the ER, right, that have like maggots and stuff like that in their wounds. Is that considered neglect? Yeah. So if you think of that person that has the gangrene and you have like the maggots swimming through, right? That's kind of like, that should spark up to your memory that, that is something, we're not taking care of ourselves, right? We need to make sure that we're on top of our own mental health and our physical health in order to be able to be good for not only ourselves, but our families and our patients. So basic human need, their deficits, right? Frontline healthcare worker conditions. So, we were mentioning again, physiological breaks are virtually non-existent. They're pretty much non-existent. Eating, to use the bathroom in between traumatic events, even rest. Have you been able to sit down for 15 minutes? You don't have time. You have to keep going or you're going to get farther behind. Homeostasis and balance of the unit. How is the milieu on the unit? Is it chaotic? Is it noisy? How is the acuity staffing handling? How are you doing with that? Is the new charge nurse so new that she doesn't understand it? Does she need more education? More education does not mean the person is not smart. It means that we have to get them the tools for them to succeed. And if that's not happening, then is the organization failing? Right? Again, we're not looking out for, one side or the other. We're looking out for definitely the healthcare worker, but we want to also make sure that because we need nurses out there, because if some of us should ever get sick, or, we have a lot of patients to take care of. So being against the organization is pretty much not smart, because we need to make sure that we can get the culture corrected, the things that are missing corrected. So therefore you have retention and people love their jobs, right? We have a lot of nurses that love their jobs and they take a lot of ownership in what they do. And this is pointing out these problems is essential in order to make things get better. So we talked about insomnia, right? We talked about insomnia, shift work, sometimes alternating shifts. I would prefer to work 12s versus 8s. Why? I have more time off, right? In between each, if I do bulk scheduling, I have more time off where I could recuperate, right? On solid block times. Juggling family, school, full-time work. There's a lot of us out there that are doing all this. So then we have safety and frontline healthcare worker input. So when I talk about these issues, it's not just something that I think off the top of my head. These are things that I have been working with nurses that are on the floor, as well as also people that, come to me as anonymous reporting to talk about all the issues that they have, as well as also combine it with what they feel could be better, right? Yes, the program is designed from, a lot from our input, but is also from research that the holes that I'm finding along the way, because it's pretty much out of tune with what is actually happening out there. So violent and verbal or physical attacks from patients and their families. So the nurse is actually having fear of losing their job through retaliating and reporting the incident. So there's a lack of insecurity. There's a lack of security. So you have this person with one of the basic human needs is safety, right? So if you have this person that's constantly afraid that they're not, if they say something, that they're going to be let go or they're going to be reprimanded because of the things that they found, then you're building that culture of not reporting, right? Because they're going to be retaliated against. So it's almost putting somebody, again, we were talking earlier about in the box, right? And then you have the lack of personal protective equipment during a pandemic. Like we have a big pandemic happening. What is happening with our PPE? What is happening with our masks? What is happening with our relationships? I'm going to keep talking about all of that. That's safety, right? Not having adequate care, not having adequate, protection. That is your safety, because you can catch COVID and who knows what could happen to you, right? And then we have 1 to 2 security officers in the entire hospital. I'm finding out that one of the protocols of one of my administrators, or one of my leadership in Nurses Against Violence Unite, was stating to me that security cannot do anything or intervene until a patient hits a nurse. So let's prevent that, okay? Injury versus prevention. Takedown versus and introducing more trauma versus having a great shift and making the patient feel good and healing and getting out and going and living their life. The more you do more of the negative, the more that's going to impede on the positive. In other words, it's not going to happen, right? So no security officers in mental health hospitals, substance treatment centers, and assisted living and rehabilitation centers. There might be, there might not be. More times than not, than there is not. So we have social sense of belonging, management using punitive approaches to incidences, and lack of healthcare system support. So when something happens to a nurse or a CNA or somebody in healthcare, instead of saying, I really appreciate you taking ownership of your job, and I think it's great with you coming up with that idea, because this is really going to be something, if you're seeing this on the floor, then maybe we need to take a look at this and make it better. Instead of having that approach, it is more like, okay, well, I reported that I got hurt from Mr. Smith, so therefore now I am found with a warning on my record. Is that punitive? Is that retaliatory because nobody wants to deal with it? Who knows? We don't know the reason why. We do know that this person that was doing out of good faith, filing a report to try to make things better, was told basically that you can't, and that and they received the penalty themselves. So is that teaching people not to report? Absolutely. Incivility and lack of work relationships, that all ties in. Why would I report if my peers are going to tell me that I'm weak? Why am I going to report if I'm going to get yelled at indirectly at your supervisor, right? Why am I going to report something if all I'm going to get is extra grief when I've got to make a paycheck in order to take care of my family? Healthcare workers are missing holidays, they're missing birthdays and special occasions. They did not sign up for that. What they did sign up for was to take care of patients and to make sure that, you know, they're giving 100% of their care. Do we know that we're going to miss holidays? Do we know we're going to miss birthdays and special occasions? Yes. But that's not just a part of the job, right? Either is getting hurt on the job, because we're going to get into more of the regulations and you're going to be surprised about what's out there. So basic human needs. So we went from, you know, social sense of belonging down to ego and self-esteem. We have the frontline healthcare workers that are not prepared to work with violent patients because the education has never taught them how to. Right. They haven't. Patients with severe mental illness or even addiction. There might be a bullet point. Unless that nurse or that educator is teaching you that has experience in these areas, nobody else is really going to understand, right? And even then, are they just skirting by just to get a paycheck? So it's very important, and that might rub somebody wrong and they might not be happy with what I said, but it's the truth. And I am very transparent, and I'll call it as I see it. Whether it hurts or not, we need to understand that there's a lack of education here. So failure of curriculum frameworks to innovate nursing education and to reflect on societal trends. How long have we had an opioid epidemic? Has it been more than 10 years? Has it been more than 15 years? It's been a very long time. So why aren't we teaching any kind of protocols? Why aren't we teaching people how to look for signs and symptoms of withdrawal so they can prevent this patient from going through DTs, having uncomfortable side effects, pain, right? It's not just pain there, right? Unless they had back surgery, it's pain here. The main reason why people become addicted is because they're in pain, unresolved issues. So, and that also comes in with a lot of healthcare workers that are using. So we can't judge when we're not willing to look at the problem ourselves, right? Then we have lack of self-esteem. When you're being told that you're not doing a good enough job over and over and over again, what's going to end up happening? Are you going to feel like you're doing a good job? Are you going to feel like you're contributing to your workplace? Are you feeling like you're doing, you know, something good for your patients? Probably not, because you're being conditioned. Yes, I said it, conditioned to not, that you're not doing a good enough job. And you're allowing that to start to change the way that you see things and the way that you are going to approach things at work. So either you can get angry or you can learn from it and do better for yourself, right? Because what's going to end up happening is that it's going to start wearing down your mental health. And that's where epigenetics, when we talk about that later on, that's where that comes in hand. Very, very important stuff. So and then we have self-actualization. So management failures to connect and build relationships with their staff. You know, they're patient survey focused. When it's in quotations, that means that's what's been said on numerous times, not just one person saying it. And the organizations are quota focused, where when you look at the HCAP surveys, they're flawed and very deeply biased for trying to criminalize the nurse and the doctor. There's something about CNA, and then whenever somebody sees a CNA, they call them nurse. So, and I'm not saying anything to be mean. I'm not saying anything to be, make anybody angry. But the only thing that's on the HCAP surveys is nurse and doctor. So when you look at the construction of the HCAP surveys, which we're going to have on here, I'm going to show it to you. You're going to see that it's completely about negative, negative, negative. And it kind of tricks the person that doesn't understand how not only to read, but they don't care about reading. And if they decide that they're going to fill it out, or if they're angry because they need to, their hospital bill is going to be more than their mortgage payment every month, it's very important that, we acknowledge all of these things, right? So we have HCAP surveys that have failed nursing. And I'm not saying the organization, I'm saying the HCAP surveys. And then we have, the is anyone really listening to what's happening? So what I'm saying is that all of these negative factors are coming into the mindset of healthcare workers. And what's happening is that they feel like they're not being heard. And when you feel like you're not being heard, what do you think that's going to build? Is that going to be a positive morale, or is that going to be a not so positive morale? And basically it's organizational failure to accept the violence on the unit. Whenever they report something, they're retaliated against, and they're told to go out there and do a better job because they didn't do it properly, and that's why they got hurt. Frontline healthcare workers have attempted to report problems, but they're often dismissed. They feel that organization is not supporting them, and they've expressed and further expressed that disconnect with nursing organizations, where it seems like they pay these exuberant amount of fees and nobody's listening to them either. So nurses are literally feeling out there by themselves with no support. So, and that's where, where Nurses Against Violence is coming in to be able to help with build that bond with people and to help them feel supported, with or without an organization and with or without an employer. It is basically to help others, to facilitate relationships, not only with themselves, their family, their work environment, and anybody else that comes around them, because they are going to affect numerous people, just one healthcare worker. And then we're going to get into chapter 2 in just a moment.